Good afternoon, Mr. Barber. My name is Sam. I'm going to be your student physical therapist assistant today. How are you?
I'm okay.
So today we're going to go over and I'm going to apply a compression wrap onto your residual limb. And what this is going to do, it's going to help kind of get that conical shape so it fits in the prosthetic a little bit better. It's also going to help decrease the edema that's in the limb at this time. And it's also just going to protect the incision overall so that it doesn't get any further damage or interrupt the healing process.
Okay.
As far as contraindications, you do not have an acute DVT at this time, and your vitals are stable. And as far as precautions, we want to take precaution if you do experience any increase in edema when you have the compression on, or if you have any increase in temperature as well.
Okay.
So we can get started if it's okay. Is it okay that I apply the compression wrap?
Yep, that's fine.
Okay. So. First two layers directly on top of each other. And that's extremely important in order to get the protection that we need for the incision. And then after you get those two layers, you want to go about an inch above from the last layer in order to get chevron pattern. And what that's going to do, it's going to help create gradient pressure, so that's an even pressure trying to get the edema out, and it doesn't cause a tourniquet style. As far as when you're anchoring it down, you want to make sure that you aren't using any of the metal pins that come with the wraps usually, because you can get poked by those. Okay, and you want to just make sure that there's no wrinkles or anything like that, because that can cause skin breakdown and have to be tighter in some areas. So, now that this is on, there's things that you should be aware of when it's on. So, if you experience any skin changes in color that last greater than 15 minutes, or if you start experiencing that you have sores or blisters developing, and if you have pain that is increasing when you're at rest or during ambulation, you want to make sure to take the compression off, because those can all be signs of something that's causing more harm to the area, and you want to make sure you address that with your healthcare provider. Okay?
Okay.
Do you have any questions?
No.
Okay, and the last thing, just you want to make sure that someone is reapplying it every 4 hours. This is because it can move throughout the day and get kind of loose, so you want to keep it nice and secure and have that chevron pattern as well. Okay? All right. And then you have the chevron.